Is technology at your work distracting you from actual work? Do you spend too much time troubleshooting PC or internet issues? IT Enabled can help. Our team of IT specialists can help you tackle your technology troubles and get you focused on growing your business in no time. Call to schedule your technology consultation, 936-225-3329. IT Enabled. We're here to help.
We are honored to have Dr. Jeff Glass with the Children's Clinic back for a second round on our Connect podcast. Welcome back.
Yes, thank you so much. It's good to be back.
Thank you.
Yeah, it's great. Thanks.
We got great feedback on the first one.
Thank you.
So we had to bring you back.
Right, yeah. Well, it's been a year and a lot's happened in the last year.
Happened.
Yeah, I'll have to go back and check, but I think you are still our most downloaded episode of all time.
Well, there you go. Well, we have to try to beat that then,
yes.
don't we? So,
yes, we had a lot of things working in our favor. We were like right in the middle of COVID during that time, and you came on to talk. And but yeah, let's we'll have to one up that.
Yeah, we'll try. We'll try.
That's right.
Well, awesome.
So since you've been here a year, kids have gone back to school.
Mm-hmm.
Let's talk about kind of where we've transitioned in a year. Starting school, we know, was kind of a crazy fiasco.
Yeah, so it's interesting. Last time we spoke, we were talking about how a vaccine would be coming out and we'd have this and everything would change. And a lot has changed. With the vaccine, things have gotten a lot better. Worldwide, nationwide. I mean, there's been 6.5 billion with a B doses of the vaccines giving out worldwide, which is really great. But in some ways, we're kind of right back where we were, a year ago. And school's a good example. I'd say school this fall was actually more difficult than last fall.
Mm-hmm.
Last fall we were all scared to death, and we didn't know what was going to happen, and we didn't even know if we should have school. There were some people saying we should just forget it.
Right.
And I was so proud of our schools last year because in our whole area, we were able to have a good school year, I think. There were spits and spurts and this kind of thing. And I mean, we had to be out sometimes, but we had athletics, we had sports, we had music and dance and cheer and all these great things. And the kids, I think, had as good a year as they could with all the proper precautions. So even before vaccines, with the mask and that kind of thing, that's all we had. Well, this year, the TEA was not very helpful in their guidance for the schools. Last year, there was a lot of guidance from the TEA, the Academy of Pediatrics, and that kind of thing. And unfortunately, this year, they didn't have that. And the unfortunate truth is a lot of that's political, and it's really sad. But people are scared to, put different things or mandates or these kind of things on people. And so the schools didn't have a lot of guidance. And so we saw a lot of discrepancies between what the schools were doing and what they were recommending and requiring. Some were really highly recommending masks. Some were saying, you don't need to. Some were keeping people home if there were families in the home that were quarantined and isolating those close contacts. Some weren't. So the school year, it seemed like we started out just like nothing was happening. Right. And very quickly, a lot happened.
Yeah, the numbers just skyrocketed.
Yeah, skyrocketed so bad. And it's unfortunate. It's just bad timing that Delta rose right before school started. And so that was a big part of the problem. Is we went through the spring, things were getting better. We were in May and we were in June, and things were actually really good. Mm-hmm. In the hospitals, we were down to 1 or 2 patients in each hospital. I think there might have been a day where we didn't have any COVID patients in Woodland Heights Hospital. Wow. And so it was incredible. So everyone's like, hey, this is almost done. We're good. People are getting vaccinated. And then right about mid to July, we started to see Delta start to rise. And it was 5%, 16%, 30%, very quickly 66%. And then by now it's 99% of the cases are Delta, and it's just so contagious that it quickly took things over. So I can remember putting some post up mid-July saying, hey, things are really changing. We went from 2 to 10 to 20 to 30 patients in the hospital. And that was right before school started. So all the plans that the schools had of, hey, things should be good. Yeah, maybe we'll wear some masks, but, we should hopefully we'll be all right. Those were all ruined by Delta coming.
I'm telling you, tell us the difference between the regular strain and Delta. Why is it so much more contagious?
So Delta really infects your cells more, and it's excreted more. Okay. And so they estimate that your viral load with Delta, how much virus you're going to have in your lungs, and in your nose and your throat's 1,000 times more
Okay.
than it is with the original strain. And the R naught, which is that that statistical number they use to figure out how contagious you might be.
Right.
The alpha strain, which was more contagious than the original strain, had an R naught of about 2.5. So that meant that every person that had it, if they were in a room with people, they would spread it to 2 people or 2.5. With Delta, that number is 4, or some people say 6. And so it's 2 or 3 times as contagious. So you're around a bunch of people, and 4 or 6 of those people are going to get Delta, and then they're going to spread it to 4 or 6 more. And so it's exponential, the spread. And that's why we saw this big boom, because it's so
And
so
is that
contagious.
really why it was more contagious to kids, just because it was infecting more people?
Yeah, so kids seem to have some degree of immunity that's greater than adults, and we think maybe it's because they're exposed to so many common cold
Yeah.
coronaviruses, and so their antibody levels are much higher. Maybe it's because they have less alpha receptors in their lungs, which are the ones that tends to grab onto. We're not sure exactly all the mechanisms, but kids don't seem to get it as much as adults do, and so that's why last school year it really wasn't bad. And although we started out the school year with quarantining close exposures to positives and stuff, we quickly realized that if both the positive person in the classroom and the contact were both wearing masks, they never got sick. And so we were able to stop quarantining those kids and keep those kids in school if everyone was wearing masks.
Right.
But then when Delta came along, it was so much more contagious. And of course, that was summertime too. So
That's
it's vacations and it's travel and it's summer camps and all that kind of stuff that when the kids hit the schools this fall, there were tons of kids that were infected, and you're contagious 48 hours before you develop symptoms.
Okay.
And so you go to school, you figure, hey, I'm fine. And then a couple of days later, you get sick, you get tested for COVID, you're positive. Well, you exposed everybody 2 days prior. And because a lot of the schools didn't have really solid quarantining or contact tracing protocols, then the kids that were contacts weren't being sent home, because remember last year it was decent because they were all wearing
That's
masks.
right.
And so they figured, well, last year not a lot of kids got it, so this year they shouldn't. And so they weren't quarantining the contacts. So then those kids would get sick, but by the time they were sick, of course, they were contagious those 48 hours before. And so kids were just dropping left and right. There were 14 or 15 school districts in Deep East Texas that shut down within, 3-4 weeks of school
That's right.
starting. It was
That's right.
awful. It was
Well,
really
are you
bad.
starting to see the numbers decline now in kids?
Yeah, so things are getting better now.
Okay.
So I think partly because of that, a lot more people started to get vaccinated. I had teachers, I had some school nurses coming to me during the summer that weren't vaccinated yet. And I told them, where there was a dad in there, said, if this was my wife going to school unvaccinated, I would be scared to death. And I don't get scared of much. COVID, most times, most people do fine. Most people, it's a common cold, but it can be really bad, especially Delta in younger people. We're seeing people in their 20s and 30s who are on the ventilator, who are getting trachs, who are dying. I had breakfast this morning with one of the ear, nose, and throat doctors in town, and she said that over the last couple of weeks, she's put trachs in 10 people,
Oh my
and
gosh.
5 of them have died. And these are young people. And so I was telling them, I would not walk into that school
Yeah.
if I wasn't vaccinated. And so I think seeing that big burst, a lot more people did get vaccinated. We've also seen people who have had COVID now who have decided to get vaccinated.
Right.
And that does boost up your immunity a lot. And people are seeing that their friends and their family are getting sicker and deciding to get vaccinated. So I think we're seeing less because people are vaccinated. I think we're seeing less because people have immunity,
That's
and
right.
so if you've had it, you're going to have pretty decent immunity for at least 3 months. We don't know how long the immunity lasts. Immunity to anything, wanes over time. And so we're seeing people that are immune. And so I think a lot of the kids who all got it, now they're immune, and so they're not spreading as much.
Right.
We've seen some schools get more serious about masks. Some schools have put in mask mandates, which have also been somewhat controversial. But in those schools that have mask mandates, we're not seeing
Yeah, the
any
numbers
COVID
are-
anymore. Of course, we're not seeing as much COVID from the other schools either. So I don't think it's just the masks, but the masks are making a difference. And so between more vaccination, more kids that have had it, the kids that haven't had it in school, maybe they have had a case somewhere, they're asymptomatic, and then a little bit more seriousness about the mask and quarantining. things got much better. So I honestly haven't had a positive COVID in the clinic for a few days myself.
Oh, nice.
That's me. But I know that other doctors in town have had positives every day. I signed some charts from Angelina Pediatrics yesterday and had 2 positives and some siblings. So it's still out there for sure. But it's not quite as bad. And the COVID that we're seeing, a lot of it's in the younger kids now. So a lot of the daycare kids and stuff like that, they're getting it as well as the school age kids. So it is slowing down, which is good.
That's good.
Which is really good. Yeah, because we're about to hit cold and flu season.
That's right.
Kind of tell us about the future. Like, is this something that, are we going to be dealing with this forever? I mean, there's a lot of alphabet left after Delta. So like, are we going to work our way all the way through that? Kind of what do you think the future holds with that?
So I was on a conference call or a Zoom. I attended a Zoom conference with some COVID experts from UTMB in Galveston a few weeks ago. And these guys are ones who are leading edge. They've done the research that has led to a lot of the COVID tests that are being done. They've helped Pfizer build the vaccine. They're constantly studying things. And it was people that were in the lab doing things and also on the front lines in the ICU and things. And their estimate, which is consistent with what most experts are saying, is that this thing's going to be here the rest of our lives. I mean, honestly, this is going to be something that becomes endemic, which makes sense, The Spanish flu way back when just became kind of the regular flu. H1N1, which was such a scare 10, 12 years ago, is part of the natural flu that we see now. And so this will become a natural part of things, which will be okay once we're all immune, once there's herd immunity and that kind of thing. But they're estimating with Delta being so contagious, we're going to need 95% herd immunity in order to really keep it settled down. And I'm okay with COVID being around here as long as the people that need to be protected are protected, as long as our health system's not overwhelmed. And that's what happened this fall, is when this whole Delta wave hit. The hospitals, as we were talking about earlier, went from 2 patients to 30. Well, at one point, they were over 50 patients in each hospital. We had more COVID positive patients in our hospitals than they had in hospitals in Dallas. So Parkland, UT Southwestern, they had less COVID patients in those big tertiary care centers than our little tiny hospitals did here. And a lot of it was because we have a largely unvaccinated population. And so those were the people in the hospital. I mean, there's some people who are vaccinated who get sick. It's usually the people with comorbidities or older people. But they're in the hospital a couple days. They generally do fine and they go home.
Right.
And so
those graphs of that everybody kept posting of here how many that are in ICU that are unvaccinated versus one that's vaccinated. It's just like the numbers. Look at the numbers, people. You know?
But the problem is people don't look at the numbers.
That's right.
A lot of people don't look at this rationally, and that's part of the problem we're in now with the vaccines is that it's a very emotional discussion. It's a very politically charged discussion on the vaccines. And so the numbers, people think, you can make numbers show anything you want, which you can. I mean, statistics, there's damn lies in statistics, right? And so, but when you look at those numbers and you really spend time in the hospital and see the number of patients that are in the hospital who are unvaccinated compared to vaccinated, it's a really easy call to really legitimately show how much the vaccine protects us. But going back to your question, so the future, so it's going to be around for forever. It's going to become more endemic, which means it's just around, rather than epidemics, which means everyone's getting it. And so that's why the vaccines are important. That's why they're emphasizing hybrid immunity. Okay. So hybrid immunity is where you have the vaccine and then you get a mild case of COVID. So you have both, or you have COVID and then you get the vaccine. Mm-hmm. That seems to provide the best immunity. And you can't just count on your antibodies because the immune system is very, very complicated. It's not as simple as, Sally on Facebook makes it out to be. And so so you can't just count on antibody level. We don't know what antibody level is really protective, and it probably depends on the person. But there's cellular immunity, and there's T cells, and there's memory B cells, and there's all these other things that help determine your immunity. And so we can't count on just looking at one number and saying, okay, well, that number makes me immune or not immune, or makes me safe or not safe. And so we're counting on hybrid immunity, which hopefully we'll slowly get to. But it'll be around, and but it won't be as big of a deal, and we'll all be okay. I mean,
it'll just be like getting a flu shot every year. You get a COVID shot.
Well, and that's one question, too, about the vaccines. Are we going to need boosters or not?
Right.
And again, when people talk about the vaccines or when people say disparaging things about the vaccines, they're like, well, why? What's the point? You're going to need a booster anyway. That means it doesn't even protect you or whatever else. But I mean, when you think about vaccines, all vaccines need boosters. I mean, when we see our little babies in the clinic, we do a tetanus shot at 2 months, 4 months, 6 months, 15 months, 4 years, again at 11 or 12 years of age. And then you need a tetanus booster every 10 years, you know? Part of the reason we still see whooping cough is because your immunity tends to drop off over time. And that's why we give a booster for whooping cough now around 11 or 12. We didn't used to do that because we know that teenagers carried whooping cough a lot and they would give it to the infants. And so we see a lot less pertussis now in the infants since we started giving that booster for pertussis at around the 11 or 12 year age. But both of you guys looked at me with big eyes like, oh, we didn't even know we did that.
Yeah.
And that's because, you don't even know you do that because the vaccines are not a big deal. Everyone's making a big deal out of this and making it into something it's not. We give shots every day. We give tens of thousands of vaccines a day in our offices. And not a day, sorry. Tens of thousands of vaccines. No wonder I'm so tired.
Good grief.
Tens of thousands of vaccines a year between all of our clinics. And the kids do great with them, and people generally do great with this vaccine too. And yes, immunity is going to wane over time. That's the way it is with every single thing. You know, if we got exposed to something and we maintained the immunity to that, we kept our antibodies to that for our whole lives. I mean, how many millions of billions of antibodies will we have in our blood? Our blood would be like sludge, because, and so and when you think about it that way, as you're exposed to new things, you develop antibodies for that. Over time, those go down and go away, and then and that's why, a booster may be necessary right now. The only booster that's required is for the Pfizer vaccine for people that are over 65 or have a bad immune system or other high-risk conditions, or maybe that are in a high-risk position. So they live in a long-term care facility or they work in a long-term care facility or a healthcare facility. They're recommending boosters for those people. On the Pfizer vaccine, they're still looking at Moderna and J&J as to whether they'll need Pfizers. Whether they'll need boosters or not. But the Moderna seems to be providing the best and longest lasting protection from serious illness and hospitalization right now. That's what I had as well. And so
let's talk about the new vaccine that's coming out for younger children. Tell us about that.
Yeah, where are we on those?
Yeah, so as you guys know, the vaccines originally came out for 18 and up, and that's what Moderna and Pfizer still are. Moderna and J&J, I'm sorry. Pfizer was 16 and up, and now we have emergency use authorization for 12 and up for Pfizer. On October 26th, I believe, which may be after this, before this is put out there, they're going to be having a meeting about the vaccine for kids 5 to 11 for emergency use for that. It's going to be the Pfizer vaccine. It's going to be 1/3 the dose of the adult vaccine, and it will require a booster, a few weeks later, just like this one does. The numbers look like it's very protective and very safe and all those same things again. And so there are a number of parents that are excited about that. I have parents who ask me on a regular basis, hey, is it out for our kids yet? When can we get it? What's the youngest age? There are a number of patients who want it, and I think that's smart. I mean, most kids who get COVID don't get very sick. 1% of kids nationwide who get COVID end up being hospitalized. So that's a pretty low percentage, but that means 1% of kids get hospitalized, and so if you got 100 kids in your school, one of those could get sick enough to get hospitalized. So we do have some kids that get sick. We have had some kids who have had that MIS-C, that multi-system inflammatory disease. That's a consequence of COVID. We've had kids with COVID pneumonia that have had to be on the ventilator. So that has happened, but most kids do fine. But some parents definitely want it for their kid to protect them from those things. And then the other thing people have to think about is those kids 5 to 11 who live in households who have people in them that are high risk. So most kids who are hospitalized are kids with other underlying medical conditions, and ones who are younger than age 5 or like 15 and up. So it seems to be the babies and the teenagers who get the sickest. If there's a 6-year-old who lives in a house with a 1-year-old, it may be a good idea for them to get the vaccine to protect the 1-year-old, because they're going to be bringing stuff home from school or from daycare and can give it to the baby. If you spend a lot of time with your grandparents and your grandma's got emphysema and your grandpa's got hypertension and diabetes, and they've been vaccinated, but still you don't want to give it to them because the vaccine's not perfect, it may be a good idea for those kids to get vaccinated. And so I really think it's those those kids who are high risk themselves or have high risk exposures on a regular basis, that would really benefit from the vaccine. Because again, with the vaccine, we're trying to protect ourselves. Obviously, we're in a very selfish society, so we want to protect ourselves. But altruistically, really what we should be doing as a society is we should be doing this for others, because that's what we're all in this together. And that's what some of this polarization has hurt us by, is we need to remember that the left or the right, they're not the enemies. The enemy is this virus, and we need to work together to protect ourselves. And so a little less selfishness and a little more saying, hey, you know what? I'm willing to get this poke because I want to protect others, or I'm willing to take the risk of a 1 in 500,000 chance of a side effect because I want to be able to protect those people that are near and dear to me. I think this is really important.
That's right. Well, let's switch our focus a little bit. What else are you starting to see? I mean, we're hitting flu season. RSV, things like that. What else are you starting to see? So
last winter was really great as a pediatrician because we didn't see any of that stuff. I had one kid who had a positive flu test, and I think it was probably a false positive, honestly. I only checked him because his mom wanted to be tested. So we hardly saw any flu last year. Right. Nationwide, there was 1% the normal flu there usually is. Wow. There was nothing because of the mask and hand washing. And the flu is much, much less contagious than coronavirus. The only thing more contagious than COVID is measles. Measles is the most contagious virus out there. Okay. COVID and chickenpox are pretty much hand in hand as far as their contagiousness, and everything is less than that. Okay. And so COVID is super contagious. So if you're able to stop COVID, you're able to stop all the other stuff too.
Gotcha. But
this year, again, most of the schools don't have any masks. We're all doing stuff together, which is great. I'm glad. I'm looking forward to Thanksgiving. We're having our families over for Thanksgiving. It's going to be great. We're all vaccinated. But we're looking forward to Thanksgiving. I know everybody is, and Christmas and things. And so, but there's going to be the risk then that all these other viruses will come back. And last spring, we'd gone the whole winter without any RSV, which, as your listeners know, RSV is respiratory syncytial virus. So it's a bad virus that causes just a bad cold in us, but in little babies makes them real sick. Yes. Well, the mask mandate in Texas was lifted in March, right before spring break. And within 2-3 weeks, we started seeing kids in the office with RSV. And then it really blew up. At one point, we had, I think, 3 or 4 kids in the hospital with RSV. Oh, wow. At one time, yeah. We had started seeing all these babies with RSV, all these kids with ear infections. I sent more kids to get tubes in their ears in June or July of this year than I usually ever do in the winter. Wow. Because, all the common stuff came back. So all the kids were getting sick, and we were seeing all this RSV and pneumonia and ear infections. And we're starting to see some of this again. I was on call last weekend. I had 3 kids in the hospital with respiratory stuff. One that I was able to keep out and 2 that had to be admitted. And so we're starting to see some of that respiratory stuff again. Right. Usually it's after Thanksgiving that gets really bad. Okay. And so we're really encouraging everybody to get their flu vaccines this year. And you can get the flu vaccine and the COVID vaccine simultaneously or one right after the other. It doesn't matter. There's no problem with that. But to get their flu vaccine, because COVID usually starts with adults. So adults get sick, they spread it down to the kids typically. But flu starts with kids and goes up to adults. And the flu, usually those epidemics start with the kids passing it around, and then the adults start to get sick. And when you think about it, kids born after January 1 of 2020 have never been exposed to the flu because they were little tiny babies during the flu season. Everyone kept them home.
Staying home with
Come March, they were a couple, 3 months old. The world shut down. Wow. And then there was no flu after that. And then there was no flu last winter. And so unless they've been vaccinated, none of those kids have any immunity to the flu. So it's just going to take one little spark, and all those kids are going to start getting it, and then they're going to spread to their older siblings, and they're going to spread to the parents, and they're going to spread to their coworkers and all the daycares and the schools. And we could be in for a really bad flu season. So we're pushing the flu vaccine this year more than about any other year, just because we're worried about that. And we don't know what's going to happen if you get flu and COVID together. Last winter, everyone was like, oh gosh, it could be bad. We could have a twindemic of COVID and flu. Well, that never happened because of the precautions everyone took. Right. But this year, we really could have that because everyone's back out living their lives. And again, which is wonderful. I'm glad we are. But we really could see that. And so It's going to be interesting to see what happens after Thanksgiving and after Christmas as far as this goes. And my recommendation to the schools that have asked me have been, which they don't ask much anymore, but has been, those 10 or 14 days after Thanksgiving, make everybody wear a mask.
Interesting.
That 10 or 14 days after Christmas, make everybody wear a mask, because if those kids come back and they don't know they're sick, they're going to develop it. If you're exposed to COVID, you're going to develop symptoms within 14 days. 97% of the time within 10 days. Honestly, with Delta, usually within 2 to 6 days, you're gonna get sick.
Right.
And so if we can keep everybody masked in all the schools for just a couple weeks after those holidays, I think we would really be able to put a damper on at least COVID spreading through the schools, and again, a lot of this other stuff too. Because they're going to be exposed to everything over the holidays. So we'll see how that goes, but yeah, it could be busy.
So flu shot, children can get that, adults can get that. So that's for everyone?
Yeah, so the flu vaccine is readily available for everyone. It's for kids 6 months and up. If you're less than 9 years old and getting the flu vaccine for the first season ever, you need to get 2. You need to get 1 and then a booster. Okay. Every year after that, it's just 1. Awesome. For kids, we start to give it as soon as possible. So we usually get those at the end of August, 1st of September. And we start hitting up kids right away. We can, because we want to get their protection in, because they're the ones that start this mess. Right. Adults, their immune response is not quite as strong to the flu vaccine, and their immunity doesn't last quite as long, particularly the elderly. So adults or the elderly, they really recommend getting your flu vaccine maybe end of October, November, so that your protection lasts through the flu season, which oftentimes is through May or even into June sometimes.
Wow. You don't think about the flu season lasting that long.
Yeah, not last year, of course, but 19. We were still seeing flu in June and even July.
Oh, wow.
Yeah, we had a couple cases in July. Okay. So, yeah, it was crazy that year, yeah.
So what is your advice for people going forward as far as, get the flu shot? Obviously, that's going to be important. COVID, so if you haven't already received the COVID vaccine, is it still time to get that? Do people still need to go out and get vaccinated? What's your advice to?
Yeah. So, again, we're heading into winter, and so we're going to be exposed to everything, and we're going to be living our lives. And the flu vaccine, the COVID vaccine is very protective against deaths and serious illness from COVID, but you can still get COVID even if you've had it. And it's people that we see who get the sickest are the people who have existing disorders or older. And so because we're going to be with grandma and grandpa at Christmas and around our aunts and uncles at Thanksgiving, we're going to be doing these kind of things. It really is important for everyone to get their COVID vaccine, whether they've had COVID or not. Just get your vaccine, and then get your flu vaccine, and then just common sense stuff. So good hand washing and that kind of thing. I don't think that everyone at Thanksgiving needs to wear a mask until we say grace and then take them off. I don't think we need to be in a gymnasium with the cowboy game on and all of us spaced 6 feet apart. Right. But just common sense things, of staying home if you're sick, getting tested if you feel bad. The rapid tests are most sensitive day 2 to 5 of the illness. Okay. So if you start to get a runny nose or a headache, don't swab yourself and figure a negative is good right away. Right. Wait a day or 2 in and then do a home test, or then go see your doctor. But try not to be around people if you feel sick. And it seems like common sense, but a lot of that's gone nowadays. Yeah. So I think if we do those things, we'll be okay. And again, we're all fine as long as the hospital systems aren't overwhelmed. Right. So if you choose to not get vaccinated and you end up on the ICU, that's fine. Mm-hmm. That's your choice. If you end up in the ICU, you know what? Sorry, that's really bad for you, but you should have listened. Right. But it's not good if you're taking a bed that now a heart attack patient can't get. Right. It's not good if you're taking a bed that somebody else can't get. And when we were getting hit really hard in August, there were people who had appendicitis who we didn't have a place for them. They had to drive themselves to Dallas to go see a surgeon. I mean, we had people who were having heart attacks and couldn't get into the hospital here and had to get transported much further away. I mean, there were, I'm on Twitter and I was seeing stories of people who, were having to just call literally tens and tens of hospitals to find places their patients to go. And I mean, we had a patient at Woodland Heights who they had to call like 16 hospitals before they found someone who could take people. They were transporting people as far away as El Paso, Albuquerque.
Oh my gosh.
That far away to get care because the ICUs were full. And so as long as the ICUs, as long as the hospitals aren't full and we can kind of keep things on a simmer, we'll be okay. It's just we can't afford for other people to suffer because of the decisions that some people made.
Yeah. Well, I have one last question. Masks. So, we all go to church, we all go into the grocery store. Is that something we still need to be wearing when we're in a public setting like that?
If you're vaccinated, I think not. It all depends on what's going on in the community. So my wife and I are both vaccinated. When COVID got really bad, this year we started wearing in the summer, I was not wearing a mask in church.
Okay.
But then when we really got bad with Delta, July and August, I wore a mask in church. And I wouldn't necessarily wear it when I was out in the sanctuary, in the back talking to people. But when you start singing and people start throwing stuff everywhere, there's spit everywhere.
Yeah.
I want to have a mask on. So I wore a mask when I was in church then. This past Sunday, first Sunday I didn't wear a mask. Of course, it's the first Sunday I've been in church for a couple of weeks because I've been at Baylor football games. But I didn't wear a mask because the numbers are down again, and so I felt more comfortable. And so, but there were high-risk people in our church who were still wearing masks, and I respect that, and that's great. So if you're high risk, if you haven't been vaccinated, if you're running into somewhere where you're not going to be around a lot of people, you're going into the grocery store, you're getting some bread, and you're coming out, I don't care. But if you're going to be around a lot of people, you're in church or you're in a big event where there's a lot of people, I still think it's smart.
Right.
But if you're vaccinated, I mean, honestly, I think you can live your life. My wife and I have been to California. We've been skiing in Salt Lake City. We went to Europe this summer. I mean, I wore an N95 on the plane. When we were in crowded areas, I wore a KN95. But otherwise, we went out and did stuff. And that's the thing that's so great about being vaccinated is you can live your life again. And there's a lot of people who haven't been vaccinated and say, well, I'm living my life anyway. And that's great. Right. But you are running that risk. And I just don't like that little tinkling in the back of my head. Right. When that person coughs next to me or sneezes, gosh,
as Blake has coughed the whole time.
As I've coughed the entire time. Maybe I need to put my mask back on. But I like to not have that worry in the back of my mind that, oh gosh, am I safe or not?
Right.
Because I know I'm safe. And if I get it, I'll get in my case, I'll be fine.
Yeah. Well, we just appreciate you so much. You've got so much knowledge, and just to be able to share it in layman's terms so that, our listeners can really understand what's going on for Lufkin and Angelina County and beyond for those that are listening. So we really appreciate you so much.
Yeah, no, it's been great to be with you guys again. And again, if you guys have questions, go to the CDC website. There's good information there. The Children's Hospital of Philadelphia has a really good vaccine website. Oh, nice. Our website, the Children's Clinic Lufkin, Children's Clinic Lufkin, children'scliniclufkin.com or angelinapediatrics.com. If you go to the news section on that, I try to update a thing about the most common myths and misperceptions about vaccines.
Really good frequently asked questions.
I think I'm up to 23 now.
Yeah.
And so I try to update that all the time. I just updated that Sunday night. And so really, what I would recommend to people is just go to people that you trust and ask for their advice on things. There's a lot of misinformation out there. There's a lot of good information out there too. It's just hard to know, who to trust nowadays. Right. And when you don't know who to trust, the best thing is to just go back to those people you do know, those local people.
Yes.
And I'm just so thankful that we do have such a good medical community here, cohesive medical community. Right. In fact, both the hospitals have cooperated, and most of the doctors in town have signed a paper saying, hey, we recommend that the community get vaccinated. We've all been vaccinated, and we really feel like it would be safest for you guys too. So we've really kind of tried to get behind things. And the school districts here have been great. They've been very good at doing their best to protect their faculty and protect their students. So we're in a good place. We're in a much better place than we were a year ago. Last time we talked, there's a lot more security and knowledge and safety around. And so, hopefully it'll be a good winter. We'll see.
Yeah,
that's right.
Well, thank you so much for coming on. And just to echo what you said, I think it's okay that we trust our health professionals again. I don't know when that stopped happening, but when we were first considering the vaccine, just to kind of share our personal story on it, I don't know if anyone actually wants to listen to that, and I may edit this out at the end, but we'll decide. I asked you and Dr. Fedone personally what we should do, and having the questions, because there is a lot of misinformation out there, and numbers can be skewed. I mean, you look at the chart of drowning deaths. If you put that chart right up against the number of movies that Nicolas Cage has released, they match up exactly. Mm-hmm. I mean, there's a difference between causation and correlation.
Yes.
And so sometimes numbers can be skewed in different ways. But when our first son was born, he had some complications, some heart complications that we were really concerned at. And I remember going into your office, and we had echocardiograms, I guess. Is that what it was? Looking at it, and we looked at this, and we were very seriously concerned. And you looked at us and you said, "Hey, this is fine. There's no problems here." And we left that doctor's office completely confident that was fine. And somewhere between that time and now, people have lost that trust. So if you're willing to trust your healthcare professionals in a situation like that, when it's as serious as a heart condition, but not willing to trust health professionals over something that's probably a much simpler answer than of what we're going through. So I want to urge people to just listen to healthcare professionals. I mean, they're not out here lying to you and trying to coerce people to do something and take over the world with microchips and vaccines and all that nonsense. But thank you so much for your time. We really appreciate you coming on the podcast again. And if you have questions, reach out to a healthcare professional, ask them about it. And not Susan on Facebook, who did her own research. So I may actually cut that last part out, but thank you so much.
Well, I can add a little bit too about the healthcare professionals.
Yes, please.
There's certainly, part of the thing is now is there's a lot more information out there. There's a lot more accessibility to things. And so, back in the day, if you needed to ask questions about anything, you would go talk to the specialist. If you had questions about your computer, about your plumbing, about whatever, about how to fix something, you would call the plumber, you would call the electrician, or you would call the doctor, or you would call the lawyer. But now, if I need to fix something on my car, I can go to YouTube and watch somebody fix it.
You can.
I'm like, okay, and I trust this person I've never seen, and I let him fix it. And I'll fix it myself. I'm like, hey, that's pretty good. I just saved myself $50. But with healthcare, there's so much more to that, and most of the people who quote unquote do their own research are doing things that are looking at maybe what some person on Facebook or Twitter or YouTube or whatever says, and nobody knows those people, so we don't know their motives, and so people who are on those sites are doing that because they're trying to get hits. I mean, they get paid for that. The more hits they have, the more popular it is. So how do you get hits? You get hits by doing something controversial. And so you talk about ivermectin, or you talk about natural immunity, or you talk about vitamin D, or whatever. And so you throw out something controversial, and then people who are looking for that get attached to that, and then they share that, and then they share it, and then it goes on. And so with your local doctor doesn't have an agenda. We don't even give the COVID vaccine in our office. So I've got no reason to promote the COVID vaccine other than people's health. There are some doctors in town who have questions about the COVID vaccine. In my experience, those are doctors that aren't clinical. They do some specialty that doesn't necessarily deal with patients on a regular basis. And so they don't see what we see. And so it is important because, like you said, the numbers can be skewed. So there's a study where they looked at people who were vaccinated who had COVID, and they looked at the amount of COVID they had in their nose and throat. And it was like the vaccinated people had 250 times, say, the amount of COVID that people who are unvaccinated had. And so people latched onto that and said, oh my gosh, look at how awful this vaccine is. The people who were vaccinated have so much more COVID in them than the unvaccinated people. So they're going to be the super spreaders. It's the vaccinated people who are spreading this to everybody. And that's the problem. And so you go on with the stuff. Well, when you really think about that, there were two things with that study. One is that they were comparing people who had COVID back in the day with Alpha, not with Delta. So Delta, of course, we know has 1,000 times more viral load than the previous versions did. But also, you really need to look at that. Okay, so that means it took 250 times the amount of COVID to make that person sick, compared to somebody unvaccinated.
Exactly.
And so if you're looking at this person sick, who was unvaccinated, who had maybe just say 10 COVID, whatever, and then this person who's vaccinated, they didn't get symptomatic till they had 250 times that. And so really, you need to look at it the right way, but it just depends on how you spin it. And so look at what the source is. That's really has to be the thing. If the source you're looking at is some popular feed, it's probably not reliable. If the source you're looking at has ulterior motives, it's political, or frankly, a lot of the religious websites, unfortunately, spread information. And as a Christian, it makes me sad. But look at the site and think about what their agendas are. When I put things on our website or when I post anything, I always look at where's this information coming from, and I'll go to their website and I'll go to About Us and I'll read, who is this? And before I share this with anybody, before I trust this, I'm going to make sure it's a verifiable, source that I do trust. And so that's one easy way to kind of vet some of that stuff out if you're trying to look at your things yourself, is really consider what the source is and what their motives are behind what they're trying to tell you.
Yeah.
So important.
It is, absolutely. And I want to recommend one last thing. If you've not watched the documentary on Netflix called The Social Dilemma, please do. We're just living in a world where it's so easy for misinformation to be spread. And it used to be that 30 years ago, if you were the town crazy person who had crazy theories about things, you were just that. And now we live in a world where pretty much no matter what you think on an issue, you can go find a community that agrees with you. Mm-hmm. If you think the earth is flat, there are 100 different groups on Facebook that you can go get on, and people will give you that confirmation bias that you're looking for that makes you believe whatever it is that you think, whether it's true or not. So great documentary about that will just kind of show you the echo chambers that a lot of us are getting put back into on social media. But thank you so much again for your time. We truly appreciate this, and hopefully this helps any of our listeners who've been on the fence about any of these medical issues, and just an update on kind of how things are going. So thank you so much for listening again to the podcast this week. We truly appreciate you listening. And if you do us a huge favor, if you go rate and review the podcast wherever you're listening, and if you want to watch the video version of this podcast, it is available on the Chamber Facebook page and on the Chamber YouTube page. Thank you so much, and have a good week.